Governor John Bell Edwards announced elective medical procedures in Louisiana that are time-sensitive can resume on Monday. Touro Family Medicine Physician Dr. Meredith Maxwell joins us to discuss what exactly that means. Good morning, Doc.
Good morning.
All right, so obviously people have been coming to you with ailments. People are still getting sick in various ways, and then they're kind of in the system but can't get a surgery. So what's going to be allowed?
So elective surgeries are surgeries that are non-emergent. Most of these surgeries kind of had been on the books prior to the outbreak. So it's going to be like cancer surgeries, like a gallbladder that has been really painful, that's not really an infected emergency surgery. Things like that, ear tubes that have been waiting, dental procedures that are urgent, emergent, painful, that could cause infection later. So those kinds of surgeries that have kind of been put on hold since the outbreak.
So, I mean, is there going to be an area where you always get gray areas to these things? They don't always get to be black and white, where it's a judgment call, where somebody who may have a minor skin cancer, for example, it's not a pressing situation, it's not melanoma, but the doctor is able to go do some procedure now where he couldn't before?
Yes, they're leaving it in the doctor's hands or best judgment as to what is considered necessary at this time. Hospitals usually have an oversight committee to decide what's put on the books, but outpatient things done in the clinic are going to be up to the physician. So, of course, you're still going to have to take precautions. Everybody's going to be tested for COVID that walks in the door. They're going to have to disinfect all the ORs. So it's probably not going to ramp up to what it was pre-outbreak.
Well, that's an interesting point. And you mentioned that when we were discussing this in the commercial, it's not just the norm. Obviously, they always clean up after surgeries, but there would be sort of extra care and a more time-consuming process between procedures?
Exactly. And then there is the thing that you have to think about. Where are they going to go after the surgery? Are they going to need an ICU bed? Is that ICU bed taken up by a corona patient? So you have to really, really think out from beginning to end about these surgeries. And then you have to take care that, that they're not going to get sick afterwards. So there's a lot more care and thought taken into the whole process.
And I guess obviously dental offices too. I mean, I'm sure there are people out there who've had a toothache that wasn't considered major enough, or they didn't feel like doing it. What should patients know about safety? How safe should patients feel about this?
So I think that they should feel very comfortable. The doctors and nurses should ask the right questions, of course. Most people are going to get tested. The facility must have 5 days of PPE equipment to perform these surgeries or procedures. And of course, if the patient has any questions or they're uncomfortable anyway, they can always reach out to their primary care provider. Another thing that you want to think about is pre-operative clearance. So a lot of these procedures do require your primary physician or cardiologist to clear you or make sure it's safe for you to have the surgery. So that's going to be an important point. So definitely talk to the surgeon to see if you need that.
A lot going into this. All right, Dr. Meredith Maxwell, thanks as always.